I don't know, you can explain to the audience how concerned we should be about measles, but it is an interesting conversation around the vaccine. And there is criticism that comes your way. Now, your messaging on it, you've been telling people to get vaccinated, but there is criticism of you, Bobby, that, oh, now you're saying get vaccinated. You weren't saying that during COVID. That's why people aren't getting vaccinated, and now it's a problem. How do you deal with that issue, and what responsibility do you have in terms of how people feel about getting vaccinated?
We're doing better in managing our measles epidemic in this country than probably any other country in the world that has outbreaks right now. We have about 842 cases, Chris. In Canada, they have about the same number. They have 1/8 of our population. Europe has 10 times that number. Our numbers have plateaued. So you're still seeing added measles cases, but the rate of growth has gone down. Now, there are populations in our country, like the Mennonites in Texas, who are most afflicted, and they have religious objections to the vaccination because the MMR vaccine contains a lot of aborted fetus debris and DNA particles. So they don't want to take it. So we ought to be able to take care of those populations when they get sick. And that's one of the things that CDC has not done. CDC has said the only thing that we have is vaccination. There's all kinds of treatments when people do get sick, and those people should be treated with compassion. I'll say, and we ought to have good treatments for them, and that's what we're developing at CDC right now, protocols for treating measles. I want to say this. We've had 4 measles deaths in this country in 20 years. We have 100,000 autism cases a year. We have 38% of our kids now are diabetic or pre-diabetic. That should be in the headlines. When I was a kid, the average pediatrician saw 1 case of diabetes in a 40 or 50-year career. Today, 1 out of every 3 kids who walks through his office door is diabetic or pre-diabetic. That should be getting the headlines. When I was a kid, 2 million, there were 2 million measles cases a year, and none of them got headlines. And we had 400 deaths. We had deaths about between 1 and 1,200, 1 in 10,000. We have so many kids now who are afflicted by chronic disease, and the media never covers them. They only want to cover measles. And what I've been saying to people is, let's pay attention to other illnesses as well. And the illnesses that are really, really damaging our country, that are existential for our country. We now spend almost $1 trillion a year on diabetes and metabolic disorder. By 2035, we're going to be spending $1 million a year on autism. Autism in 1970 was 1 in 10,000 Americans. Today, it's 1 in 31. In California, it's 1 in every 20 kids, 1 in every 12.5 boys. This is what the media ought to be focusing on, and it's not. And because of that, we don't have the solutions, and we don't have the cures.
Mr. Secretary, Stephen A. Smith here. Thank you for coming on the show. HHS reduced your employee status from 82,000 to 62,000 employees, if I remember correctly. Cut about $1.8 billion, but nevertheless, you got a lot of American citizens wondering how on earth are you going to ensure that we're going to become a healthier society with over 20,000 less employees to look over things and purview things to some degree. What do you say to that?
Well, I would say during the Biden administration, my agency grew by 38%, and Americans got sicker. So it's not throwing money at it or hiring people that is solving the problem. We have so much redundancy in our agency. We have 100 communications departments. We have 40 IT departments. We have 40 procurement departments. What we did is we're streamlining the agency and we're recalibrating its trajectory so that people there are narrowly focused on one issue, which is how do we end the chronic disease epidemic? When my uncle was president, 3% of Americans had chronic disease. Today it's 60%. It's costing us $1.6 trillion a year, about 95% of our healthcare budget is going to chronic disease. When my uncle was president, we spent 0 on chronic disease. 74% of our kids cannot qualify for military service. So this is an existential threat to our national security. It's an existential threat to our economy. And we have to narrowly focus on that. And that's what the new HHS is doing.
That was an excellent answer.
That's it?
That was an excellent answer.
I mean, let me tell you, you talk about a disease you were able to cure.
That's right.
And I'll go further. I'll go further. Most political appointees are pinheads, all right? In my 50 years experience in journalism. They don't care about improving things. They care about their job title, their prestige, their expense account. But Stephen A.'s question was right on the mark. And I go, ooh, that's a good question. You had an answer that everybody could understand. And that's what more people should do. And you know me, Kennedy, I wouldn't kiss your butt at all. I'm telling you the truth.
You never have, Bill.
All right, Bobby, on that note, I'm going to let you get back to work. Thank you very much. You're always welcome here at NewsNation to make the case to the American people. I look forward to seeing you taking on some of the most rich and powerful interests, which are the food companies and the drug companies in this country, if you're going to get after chronic disease. And you have a place here to make that case whenever you want it. Good luck doing the work of the people, Bobby. Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.